All good.
So good evening, everyone. Thank you all for joining us for tonight's information session on water quality issues within New Jersey's prisons. My name is Sydney Bogan, and I'm a current graduate research assistant at Kean University, as well as the project coordinator for Women Who Never Give Up. And I'm really excited to share about Clean Water Actions and Women Who Never Gives Up, our clean water campaign in New Jersey's prisons. Before we begin, I would first like to acknowledge that the land on which we gather today is a traditional, ancestral, and unceded territory. We honor and respect the enduring relationship that exists between indigenous people and their traditional territories. So tonight we have some really amazing guest speakers. First, I'd like to introduce Rebecca Worth, the interim executive director for Women Who Never Give Up. And then following her will be Amy Goldsmith, the state director for Clean Water Action, to share more about both collaborating organizations and how they are contributing to this initiative. So I'm going to stop sharing my screen.
Well, good evening, I guess, everyone. I'm Rebecca from Women Who Never Give Up, and I am the interim executive director. And let me just try to get this up. Can everybody see this?
Yes.
Yes. All right. Awesome. So, yeah, my name is Rebecca Worth. I'm a recent graduate from Rutgers University, and I've been just working with Women Who Never Give Up for over a year now. And I started as a management policy intern in July and June of 2023 through Rutgers, and am now helping to executive manage them. So Women Who Never Give Up, here's some of the background. So I'm gonna, hopefully you guys can see that lovely lady right in the middle. Is Gail Muhammad, who has pioneered this community-based grassroots carceral care and advocacy nonprofit for over 20 years. And Gail has collaborated with countrywide organizations, so other grassroots organizations, to accomplish legislation, advocacy efforts, and programming that has assisted marginalized and justice impacted communities. And Women Who Never Give Up accomplishments by the wonderful leadership of Gail Muhammad is recently the Clean Water Initiative that we're partnering with, Flashlights Conference, which is in collaboration with Jailhouse Lawyers Initiative and the NYU Bernstein Institute for Human Rights, and then the Grow with Google web training program that has recently was recently done in New Jersey prisons, the Just Mercy campaign, and then advocacy campaign for Assembly Bill 1986, as well as other unnamed but just as important accomplishments.
Thank you, Rebecca. And Amy is Goldsmith, once again, who is the state director for Clean Water Action, who is going to share about the organization.
Thank you very much. It's such a pleasure to be here. My name is Amy Goldsmith. I'm the state director for Clean Water Action. And Clean Water Action's mission is to protect the environment, health, and economic well-being of the community and of people most vulnerable in our communities, including people who are incarcerated or overburdened communities like Newark and elsewhere. And Clean Water Action was founded in 1972. We helped draft and pass the original Clean Water Act and Safe Drinking Water Act, hence our name, Clean Water Action. And we're all about action and not sitting by the sideline. And I just want to say one thing that we did before Sydney approached us about getting involved in this campaign. In 2021, we were approached by other advocates for people who have been incarcerated concerning drinking water quality in the prison systems in New Jersey. And we approached and pressed the New Jersey Department of Environmental Protection to address and investigate and get remedies to the issues that we were hearing complaints about. The New Jersey Department of Environmental Protection did an analysis, did find irregularities. They did find that they weren't doing the sampling and the monitoring. They weren't correctly. They weren't reporting. They weren't flushing the systems to ensure that Legionnaire's disease didn't happen. They were not issuing notices of violation to the staff and to the people who are populating the prisons. They also did not have unique water management plans, which they're supposed to have. And every single facility has a unique system. They also didn't have like proper protocols, like who actually is minding the water system and the like. So they issued letters to each of the individual facilities. But what they did about that, and if they took further action, it's not entirely clear. So it was really exciting when Sydney approached us about new developments, new concerns, and about not just the bottled water, but lack of access to it, lack of free, safe access, and why should people have to buy water in the first place? You shouldn't have to be doing that. So we're so excited to be a partner, and Ed Braithwaite, our environmental justice organizer, and Sydney connected up, and Clean Water Action is fully behind this effort. We're thrilled to be in partnership. We want to continue to do this work and to seek the justice that we all deserve, whether we're inside or outside the prison system. So I'll turn it back to you.
Perfect. Thank you so much, Amy and Rebecca. So like I said, super excited about tonight's information session and panel. Just give me 1 second. I'm going to share my screen. Everyone can see my screen okay? So, like I said, super excited about the collaboration between both Women Who Never Give Up and Clean Water Action. As I briefly stated earlier, I'm a graduate research assistant at Kean University, and during my undergraduate studies, I conducted research under the guidance of my advisor, Dr. Galia Shokri, on the environmental and health impacts for New Jersey's incarcerated population. From that research, I connected with X Braithwaite, who is the EJ organizer for Clean Water Action, and together we have launched this campaign to educate and address the environmental and justice issues within New Jersey's prisons. So like I said, tonight we have some really great speakers. First on the agenda, I will briefly discuss water systems and quality issues within New Jersey's prisons. We'll talk about what are public community water systems, laws that regulate these systems, and the recent violations that some prisons have received. Then we will have our panel discussion. Our moderators for that segment will be Destiny Thorborn and Alexandra Ramaj. And we will be hearing from Ronald Long, Sean Washington, Philip Dixon, and Rashida Smith, who will share their firsthand experiences with water quality issues within New Jersey's prisons. We then will have Dr. Jacqueline Yan, who is an assistant professor of epidemiology at Drexel University, who will talk about the health hazards of incarceration. And then lastly, just to tie this entire information session into a nice little bow, X Braithwaite will discuss our clean water campaign and ways that you all can help get involved and just support this cause. And then lastly, any last minute questions that the audience will have. So without further ado, we're going to go ahead and get started. So once again, I will be discussing the water quality issues in New Jersey's prisons. So I'm going to talk about public community water systems, what it is, aquifers and water sourcing, what are non-public community water systems, water permitting, health risks, and why this is important. So a public community water system is a water system that serves at least 25 people or have at least 15 service connections. All public community water systems are required to comply with both the Safe Drinking Water Act and the Clean Water Act. And so in terms of correctional facilities, New Jersey has 3 that are public community water systems. So the Albert C. Wagner Facility, Bayside State Prison, and Mercer County Correctional Facility. And so the way that a water system works are things called aquifers. So an aquifer is the formation of rock or settlement that contains groundwater. So you can think about it as if you're at the beach and you're digging through sand, and at a certain point in the sand, you start to hit water. Aquifers are kind of the same thing, just with rocks. So the process for that, facilities will drill wells into these aquifers to tap into the groundwater. Once that happens, they'll extract the water that then passes through a treatment facility. So it'll make sure that there's no contaminants in the water. And then after that, it will be distributed into the facilities. So if you guys see on the right-hand side, there's just a little graphic that explains that. So you have the source aquifer, and there's a line connecting it to the water system that then helps treat it, make sure there's no contaminants in there, and then it'll get distributed to the different prison facilities. And so the difference between that and non-public water systems, so Northern State and East Jersey State Prison are not considered public water systems. They receive their water from other sources like municipality water supplies. However, they still also run into water quality issues. New Jersey's prisons are some of the oldest buildings in the state. So aging pipes have the ability to allow dissolved lead, iron, and other heavy metals to seep into their drinking water. And so this is just a picture from a 2021 Ombudsman report. There was a leaking pipe, and as you can see in the picture, that's the water that's coming out. So it's not clear, it's actually orange. And so if you think about it, Bayside Prison was built in 1970. So then Trenton State was built in 1836. So you can only imagine the water coming out from those aging infrastructure and those pipes. And then so water permitting. So the Safe Drinking Water Act was passed in 1974. And the goal of this act was to help protect public health by regulating the nation's drinking water supply and ensuring its safety. So this essentially set a bunch of standards for drinking water quality and ensuring that water suppliers oversee the standards regulated by the government. So through monitoring, sampling, and reporting, these public community water systems are supposed to ensure that their water is safe to the population. However, even though these safeguards are in place, these public community water systems, that is Albert C. Wagner, Bayside, and Mercer County, have failed to report, monitor, or sample some of their contaminants in their water. So for Mercer County, for the past couple of years, they have been not in compliance with the maximum contaminant level for PFOs. And exposure to PFOs causes significant problems to someone's immune system, their endocrine system, and both their liver and kidneys. And then the Albert C. Wagner, which serves Garden State Youth Correctional Facility, which is an adjacent facility, has received violations for failure to monitor and submit samples to both, to 1,2,3-trichloropropane, which is a known carcinogen. So that just increases the risk of getting cancer for those that is consuming this water. And so why is this important? So the NJDOC does not allocate an operations and maintenance budget, making preventative maintenance and water quality oversight extremely difficult. Like I said, a lot of prisons' infrastructure is aging, so there's a need of constant repairs or constant maintenance, and without a budget allocating that, there tends to lack water quality oversight. And then those incarcerated in these facilities have complained about odor, taste, and consumption of getting sick after consumption. And so that kind of brings us all back. Without properly monitoring, reporting, or sampling contaminants, there's no verification that this water that they're drinking is completely safe. They're limited in the amount of water bottles that they can purchase per month. It's about 48 water bottles for the entire month. And so after that, they're forced to drink water that is contaminated and is not being properly monitored and reported. And it's just a huge human rights violation and a huge health violation when these contaminants that are carcinogens and have significant effects on one's bodily systems So without proper monitoring or reporting, there's no telling what is really going on with the water. And I would like to open the floor up to any questions from the audience.
I have a question.
Yes.
Hi. Hi, everybody. My name is Paul Chisholm. I remember when I was incarcerated in Northern State. I think this was around 2010.
Mhm.
And I remember the officers were saying something about it was something going on with the water there. And there were quite a few inmates who were going down to medical and they were being diagnosed with something. I was trying to remember this all day and trying to contact a couple of people, but nobody could remember, but they couldn't remember the name of what I'm trying to say that it was. It was some type of bacteria that was actually in the water that was causing
Legionnaire's disease.
no, it wasn't that. It
Okay.
was it was something else. And it was quite I was on A unit then, and it was quite a few people coming back uh being diagnosed at from medical. And that really set off a panic and a scare. And a couple of the officers were telling me this is why they've been oh, what happened? Oh my God.
We can still hear you.
Oh, sorry about that.
No,
Oh
you're
yeah,
good.
they were saying that sorry about that. They were saying that this is why they were all coming in with bottled water. It was already a lot of talk saying that Northern State was built upon a toxic waste dump
Yes.
site. I remember that back in
Mhm.
the 80s. It was no prison there, and it was a dumping site. It was just a lot of dumping site. But a lot of the officers were saying, and I was saying this is why they came in with bottled water. And it just made me start thinking about not just there, but the city of Newark and the surrounding cities of Essex County.
Yeah. So there's actually there's like a statistic, it's like 1/3 of federal prisons are a Superfund site.
Right.
And then in New Jersey, half of the prisons are actually on contaminated sites, with
Right.
the other half nearly within a mile
Wow.
radius.
Wow,
So
that's a
we've
lot.
heard,
Wow.
even from Northern State, we've heard some recently released individuals talk about oozing green stuff coming from the floors of the prison.
Oh,
Um,
wow.
and it can be linked to being on a contaminated site.
Right.
Yeah.
I remember a lot of times the almost like sulfur, like egg smell.
Mm-hmm.
You can smell that coming out of the faucet. And, a couple of people that worked for the prison say, oh, that's normal, this and that. I don't think nothing like that was normal. I'm not a water expert or any type of purifier or whatever, but I just always thought that it wasn't normal.
Mm-hmm. Yeah. Thank you for sharing.
No problem.
Ron?
Yeah, I just wanna, you mentioned that everybody could buy water in the facilities, and though it's limited in how much you can purchase. I just wanted to add that not everybody can purchase water. First of all, not everybody can afford to purchase water, but the more important thing, if you're in an RHU unit or other type of disciplinary or type of housing, you're not allowed to purchase any water.
True.
Mm-hmm.
True.
You're not allowed any bottles. You can't
True.
purchase shampoo. You can't purchase water. They've done away with all that. So there are people who have no choice but to drink the water coming out of the fountain.
True.
Of course, just wanted to add that I didn't
No,
have a
thank you.
specific
That
question.
provides a lot of insight.
I
Okay, so
wanted to add, one of the things that you discussed in your presentation was the PFOCs that were being used. Now, in 2019, in the city of Trenton, we woke up to our water being purple. And it turns out that there was a massive leak of PFOCs that had contaminated the water supply. Now, most people don't know what PFOCs are used for. Primarily it's for the anti-stick coating in inside of cans. It's the anti-stick coating on cookware, those type of things like that.
Mm.
Now, the problem that we had with the purple water is you know, I was at the time, I was president of the Trenton Incarcerated Veterans. And so I directed all the veterans in the jail to save the water in a water bottle or a soda bottle.
Mhm.
The prison went around confiscating those bottles of water. So we lost the evidence that we wanted to use to prove that contaminated water was being forced upon us. So, are you still there? Hello?
Okay.
Yes, we can hear you.
Yeah.
Oh, okay. My screen, it just went black. So we had lost all the evidence that we had to
Mhm.
prove that this was in there. Now it's difficult as prisoners when you wake up and your water smells like gasoline.
Yeah.
So
Right.
you automatically panic because you don't have the ability to substitute the water that you're drinking with something else.
Mm.
You know, one of the biggest proofs that they know what's going on is that there are pallets of water at the front door of the prison, thousands of bottles every day, but it's only for the officers and the civilians, and
True.
it's free to them.
True.
Mhm.
Now, I did an Oprah request to find out how much money is allocated for that water.
Mhm.
One of the things that people don't know is that there's an exception to the Open Public Records Act that anything dealing with finance, they don't have to tell you about.
Mm.
So they hide it under, well, we can't disclose that. And then they hide it under, well, we didn't provide it, the union provided it. So, and the union, as not being a state entity, is not subject to OPRA, the Open Public Records Act. So we can't find out what's going on with the water. Now, Trenton State Prison, being the oldest prison, or actually being the oldest functioning prison in the entire country, has more problems with not just contaminated water from the city, but the water is also contaminated from the environment of the prison itself. You have to remember that lead paint and lead was used in roofing materials and supplies at the construction of the prison in the 1800s.
Mhm.
So environmental contamination is still contaminating the water. And we have to deal with it in that way as well.
Mhm.
And
Mhm.
so the cost of water, the cost of water is problematic when your entire population, 80% of it is only receives $15 a month in state pay.
Mhm.
So, and a bottle and a case of water is $12.95. So, what do you think is going to happen?
Yeah.
Right.
Mhm. Thank you so much, Philip, for sharing that insight and providing that. I do want to be mindful of everyone's time, so we are going to transition into our panel discussion. Now to our moderators, Alex Romage and Destiny Thorborn.
Thank you for having me tonight, Sydney. My name's Alexandra Romage, and I am a supporter of the Clean Water Initiative.
Hello, I am Destiny Thorborn, and I am also a supporter of the Clean Water Initiative. Today, we are going to be asking a few questions to get through. Each panelist will have the opportunity to share their experiences with both myself and Alex. We will be alternating between the questions, and we'll open at the end, we will open up for audience questions.
We'd like to start by having each panelist introduce themselves. For the panelists, could you please share your name and the facility or facilities in where you were incarcerated?
Starting with who?
We can start with Rashida Smith.
Okay. I believe she did say she had to join from her phone. I'm not sure if she was able to make it back yet.
So if Rashida's not yet ready, we can move on to Ronald Long.
Okay, hi y'all.
Hey, Ron.
Hey,
How you doing, brother?
All
Beer.
right, good to see you.
Good to see you. Good to be seen and not viewed. Not yet, anyway. Well, my name is Ronald Long. I spent 37 years in the New Jersey prison system, 5 years on New Jersey's death row from 85 to 90, and then from 90 until 98 behind the wall Trenton State Prison. Then I moved on to Rahway, Southwoods, Northern State, and back to Southwoods, back to Northern State. And the water, I always had people purchase water for me because I was one of those guys that was limited to $15 a month due to them taking all of my money for fines and all that stuff. So
Did you get the link?
The water was terrible. The water was terrible then. And then, I learned about a 2021 investigation where Legionnaire's disease had actually hit Northern State. So it was there when I was there. I left there in 2019. And at least one person, maybe two people passed away, but they didn't want to make a link between the water, the Legionnaire's disease, and the COVID. So everybody just got brushed aside as being a victim of COVID. But the water there was so terrible that people were getting sick before that, before COVID even came, before I left. And I remember sometimes seeing like little puddles of water outside with like dead fleas and stuff like that, from water just running and running and running and leaking all down the side of the building. But I'm curious to know what's the next step after this. They say, I'm playing a chess game. I would like to know what's the next step after this meeting, and if there's going to be any type of report generated, and if the DOC is going to issue any updates. Now, Philip was talking about the Open Public Records Act, and making everything so difficult to get. I was a master at using Oprah, and I know how to get what I want when I'm after it, just like anybody else. Out here, I'm not subjected to the those strictures of Oprah. But I'm curious as to know what's the next step beyond this, because I want to be a help and an advocate in every way possible, especially me having come from there. So, I'll listen to the rest and I'll mute. And if you want to ask me some questions, then you can ask me some questions. I'm a mute right now. I just had some guests walk in. Okay.
Thank you, Ronald, for sharing with us. We can move on to Philip Dixon.
Hello, everyone. I'm Philip Dixon. I spent 39 years, 4 months, and 26 days in New Jersey prison system. 37 years, 6 months of that in Trenton State Prison. 5 of those on death row. And I've dealt with the water situation since my arrival in the prison system. And unlike Ronald and a lot of people, I'm not interested in being an advocate. I'm interested in being an irritant to the Department of Corrections and their policies of withholding information. As I said earlier, I've been fighting them for a long time on the water system, not only as president of the Veterans Group, but as the executive secretary of a branch of the NAACP, which I started in Trenton State Prison. We had a Legionnaire's outbreak in 2023 in Mercer County, and the prison system deliberately withheld that information from the inmates. When I found out about it, I went after them. They said, well, Legionnaire's disease is not a problem unless you breathe the water and not drink the water. I asked them, what do they think happens to aerosol the water when you're in the shower? Do you think it would be inhaled? And they said, no, nobody inhales water in the shower. It was a nonsensical response, but it's typical of the way they dodge and hide and conceal when they're in trouble. So I want to be an irritant. I want to go after them in every way possible. And I want them to recognize that what they're doing is causing more harm than down the road for a lot of people. Thank you.
Thank you very much, Philip. We have 2 more panelists that we want to introduce themselves before we move on to the questions. Next will be Sean Washington.
Hello, good evening, everyone. Can you hear me?
Yeah,
Yeah.
First of all, thank you for the invite. It's an honor. I appreciate it, and I see so many good people that I know and recognize. Okay, I'm Sean Washington. I'm a 2020 exoneree. I spent 25 years in prison for crimes I didn't commit from 1995 to 2020. And in 1996, I was in Northern State on a parole violation before I went to trial and got convicted for about 6, 7 months. And I recall the water in Northern State being horrendous. It had a real bad rotten egg smell. And we were told not to drink it, which a lot of people didn't. We had to drink boiled water for some reason. I mean, because I guess the water was bad. Then in 1996, I lost trial and went to New Jersey State Prison in Trenton, where I spent 23 and a half years. And the water there was extremely bad. Listening to Mr. Dixon and other gentlemen, I recall, the problems with the water. And when it used to rain real bad in Trenton and the creek would flood and everything, the water inside Trenton would be brown and it had a horrendous smell to it. And so it's a history of the water being bad. And I'm learning now about a bunch of gentlemen getting sick and passing away behind drinking that bad water. And like the gentleman explained, our access to water was very limited. We're only allowed to buy a certain amount of bottles of water on commissary every couple of weeks. But they had so many cases, where they would have for the officers and the staff. Especially a couple of times I recall where it was state of emergencies, where the officers would have to do overtime, spend overtime, because they couldn't leave. And they would go to the commissary with water that they had for us and supply to the officers who had to do their overtime. So it's definitely been a problem with the water inside the prison system in New Jersey for many, many decades. And I appreciate, the actions that are being taken now to try to do something about it, because I believe quite a handful of gentlemen have got sick from that water, got cancer and other terminal diseases and passed away. All right. Thank you all very much.
Thank you so much, Sean, for your input. You guys have honestly answered so many of the questions so far. Let's move on to Rashida Smith. Can you introduce yourself and just inform us on the facility that you were incarcerated in and about your time there? And then we'll get into the questions next about the quality of the water.
Hi, yes, good afternoon, good evening. My name is Rashida Smith, and I was incarcerated at the Manhattan Correctional Facility. And I was there for 16 and a half years. Well, let me put my camera on. I'm multitasking. I'm over here doing mommy duties. Whew. Hold on. Okay, so I had to come upstairs because a little secret is my 9-year-old daughter doesn't know about my past. And we're not ready to share that information with her yet until she gets a little older and understand. So I had to run upstairs real quick. But I did 16 and a half years in, at the Manhattan Correctional Facility, and definitely had water issues, definitely had to deal with the Legionnaire disease in the water system. We were allowed to order bottled water, but we had a restriction on how many cases we can order. And it was restricted to 1 case. And there were many times when they were out of stock. And during those times that it was out of stock, we had to either boil the water, which was boiled in a microwave, and we had to use that water to cook, or either boil it and then put in the refrigerator and put it on ice or something to drink it. I was one of the fortunate ones that worked in the kitchen, so I had access to boil water and put it in the freezer or in the refrigerator to be able to drink clean water or cook water. And I used to also, provide it to my friends who couldn't afford to buy bottled water. And it was plenty of times where we had advisories that we couldn't even use the water. The water was shut off. And there was times where we had to go days without even showering because the water was shut down. And then there was times where we didn't have no hot water for a long time for whatever reason. But like somebody mentioned, when it came to finance and certain things, we didn't get the explanations. We just had to deal with the circumstances. And we just had to pretty much survive. You know, the survival skills kicked in. And we had to just do what we needed to do to get by. And I know plenty of people that have came in healthy and left out sick. Now, if it was contributed to the water, we don't know. We would never know. But I know that a lot of my friends came in healthy and some didn't make it out.
Thank you,
You,
Rashida, so much for informing us about this. We want to
yeah.
get into some of the questions in detail for each of you guys to really tell us about your experiences. So let's start off with, can you tell us specifically about the water quality? Like, what did it look like? What was the color? What did it smell like? What did it taste like?
The smell, I never got a smell from it, but depending on the day, you can get yellow water, you can get brown water, you can get a tinted white, a white with a little tinted brown in it. You know, there was times where it was different colors. Sometimes it came out really brown, you know, and of course they would tell us that they was working on some pipes. You know, they'll use that excuse. They was working on some pipes or whatever. And the taste, it had like a I want to say like a metal type of taste to it. You know, that's it's not like I've ever, you know, ate metal or anything like that, but it just had like a really, really weird taste to it. That it made you not even want to drink it, you know, at all. But what took it for me was the many times that I woke up in the morning to brush my teeth and the water was either yellow or brown. So thankfully, you know, I was blessed to have a family that was by my side. So I had, you know, bottled water, and I would use the bottled water to brush my teeth with.
Thank you,
You know,
Rashida.
more often than you would like.
I'm really sorry about that. Thank you so much, Rashida, for sharing.
Yes, no.
Would any of the other panelists like to speak on their experiences on the water quality to tell us a little bit more detail about the specific water qualities you faced?
I can give you some. This is Philip Dixon. One of the problems is, and my brother Sean Washington discussed this earlier. In the city of Trenton, the Trenton Water Works is located on the Delaware River. And every time it rains, the river overflows into the waterworks. The problem is Trenton Sewage Works is right down the river. So there have been times that we've gotten brown water that is brown for a reason. I hate to be graphic with that description, but everybody had peanut butter jars with brown water in it that wasn't from peanut butter. We've had water that was, as I described earlier, purple from chemical leaks. We've had water that had diesel oil in it from the generators that they have at the prison, that whenever they fill the bunkers, the generators overflow and the diesel water contaminates the drinking water. And what most people don't know is that 1 ounce of diesel fuel can contaminate 1,000 gallons of water, and it can't be cleaned. So all the boiling in the world isn't going to do anything for it. So you have to deal with those things. We use a white t-shirt as a filter on the water, and the t-shirt would be the same color as a cardboard box after 5 minutes. So these are the ways that you deal with, or as we say, we prison manufacture our own ability to circumvent this problem. You know, we don't have personal water filters like a pure filter or a pure drinking straw, one of those things like that. So you have to deal with it the best way you can. And all the boiling the water in the world ain't gonna do you any good in Trenton because there's no way to boil water. We didn't have microwaves. We don't have stingers. we have absolutely no way to boil water.
Thank you very much, Philip, for sharing that and making us more aware of what's going on within the prison system, because this is not information that is being willingly shared with citizens. And this is something that more people do need to know. I would like to hear more from Sean Washington and Ronald Long, and to speak more so on the facilities. Would you say they adequately handled any protocols when it came to talking about any issues or concerns such as water testing results, water quality violations, boil water notices, or health risks? How do you feel like the facilities handled these instances?
By not handling them?
That's right.
Or not handling them?
Ignoring them.
Hello, everyone. Again, this is Sean Washington. My experience with the water, I concur everything with everything everyone is saying about the quality of the water, the color, the smell. But I recall when I first got there in '96, they had stingers, something called stingers and hot pots, but they took them out after a few years, and we were able to boil our water, so it wouldn't be contaminated. Plus, I worked in food services for a little while. They had a hot pot inside the pantry, and I would always get my water from the hot pot, and I drank the water. I think once or twice I drank the water out of a water fountain. It had a funny taste to it. So I stopped drinking the water inside prison. I would keep bottled water, and I would boil water or get water out of the pantries, out of the hot pot, and it was extremely hot. Sometimes we would have to boil that water too. But yes, so the water, and as far as those addressing the water issues, I don't ever recall them addressing the water issue. I recall men complaining about it, and they would like minimize it. A couple of times, I think they sent out little memos about some construction pipes, but they would never fully address the water problem. They would try to minimize it and downplay it like it wasn't that serious. All right, thank you.
I've got a small little point. My name is Hardwick Stiers. If people know me as W. I was in Bayside, Southwoods, and Rahway for a little bit. So when I was in Bayside in 2022 in the camps, I was on a work detail, and I was literally listening to this corrections officer basically sit there and talk about how not only is the water plant the water treatment plant basically been sitting dormant, they literally abandoned every work detail. I don't think there's actually anybody working at the treatment plant. I don't know if that's possible or scuttlebutt, but I mean, when we passed by it a couple of times, there's nothing going on there.
Thank you very much for sharing that with us. Can we hear from Ronald briefly before we move on?
Ronald, you're on mute. Now you're off mute, but we can't hear you. No.
I think he might be having audio troubles.
I think so, yes.
Maybe connected to some other device or something. That happens to me all the time.
I still would like to be considerate of everyone's time, so we definitely will follow back around at the end of the information session for a Q&A. But thank you so much, Rashida, Ronald, Philip, and Sean, for sharing your experience with us, and for our amazing monitors, Destiny and Alex. I would like to now give the floor to Dr. Yan, who will talk about the health hazards faced by incarcerated individuals.
Thanks, Sydney. Thank you so much for having me. And thank you so much to the panelists for just speaking your truth and sharing those experiences. And really like highlighting not just that these were happening, but also the actions that folks were taking to protect themselves. I think that part of the story is just as important as those harms. As Sydney said, I'm Jackie Yan. I am a faculty at Drexel University. I'm an epidemiologist. My work broadly looks at understanding the ways that mass incarceration harms our health, harms the health of incarcerated people, but also that of their families and their whole communities. And the way that I got into that work is actually related to water. And when I was getting my doctorate, I got involved in a campaign that was called the Deeper Than Water Coalition in Massachusetts. And I still work with them really closely. It's a coalition that is led by currently incarcerated people. And it started kind of around 2017 or so. And for 5 years, the MCI Norfolk in Massachusetts needed to replace its water treatment system, but hadn't. And so a lot of the problems that folks were just talking about on the panel were things that people were experiencing at Norfolk. And Philip, when you were talking about the t-shirts, the t-shirt water filters, the same thing. People were using t-shirts for water filters. And when you were talking about trying to collect the water sample, I shouldn't say this on Zoom, but it's, I think, been long enough. We were able to sneak out a water sample and we were able to test a water sample. And what that and previous samples done by the Department of Environmental Protection showed were these high levels of manganese related to sediments in the water. And so this campaign, I could speak on it for a long time, but what we did many actions over the years. And a lot of call-in campaigns, and especially a lot of pressure on the Department of Environmental Protection, but also the Health Department to really get them to start to actively monitor and test. And then not only just do those tests, but through public records requests, share the results of those tests so that people know really what was happening. So the treatment facility at MCI Norfolk for the water was replaced. But that was never really the end goal of that campaign. Our name, Deeper Than Water, is because we always knew from the beginning that prisons are toxic places. Prisons are not designed as places of health or healing. And we knew that it has to be deeper than water, and it has to be about decarcerating and getting people out of prisons. Because if it's not the water, it's something else. And so really studying those health effects has been sort of what I've done ever since then. And a lot of the work that campaign has done after the water treatment facility got fixed has switched to really focus on healthcare and medical neglect that's happening in prisons, in part because of the really tragic and harmful experiences people had as a result of the water, but also as a result of being incarcerated in really dire conditions of confinement. So I guess I won't take up too much time on our panel today, but I'll just talk really broadly about some things that a lot of the panelists know or talked about. And if you were previously incarcerated or your family was, these are things that you probably already know or have heard of or maybe have experienced. But I think it's important to think about when we're talking about especially water, but other environmental contaminants in prisons and in other environmental health harms and exposures, is the ways that those kind of build off of each other or are related. So like an example that came from my work in Deeper Than Water is like the relationship between the water and extreme heat. We know under climate change that the number of extreme hot days are increasing. And especially in the Northeast, a place where it hasn't previously been historically very hot, the water conditions and having to drink extra water when it's really hot is especially dangerous. But it's also very dangerous for older people who are incarcerated, people with chronic disease. On average, folks who are incarcerated are more likely to have different chronic diseases compared to the general population, like including heart disease, maybe taking medications for that interact with heat in negative ways, or respiratory disease, which can also be exacerbated under extreme heat conditions. And so thinking about those intersections is not only important for like understanding the health of this population, but also for moving forward and understanding the case for why this is such important action, and making that case publicly. What else did I want to talk about? I think another sort of broad thing that kind of came up in the panel a bit was the ways that it's not just water that is a harmful environmental exposure, but the ways that people are experiencing toxic water in the context of, for example, solitary confinement. I think someone mentioned RHU and being restricted in what water is available in RHU. But this generally having limited control over your surroundings, experiencing the stress of incarceration, or grief or strain on family relationships, we know that stress has these really intense effects on the body. And when you combine that with other environmental exposures, it's added harm. I'm surprised no one mentioned food on this call either, but especially food. Yeah, I'm seeing a head shake from Rashida. Yeah, it is, yeah. Having adequate nutrition is so important for health, as we all know, but that is often not what people are accessing while they're incarcerated. There are other environmental contaminants like potentially asbestos or mold or pests, especially the pests or treatment for pests can be huge problems. Yes, some head nods there too. We did some folks inside a couple years ago wanted to survey incarcerated people in Massachusetts, and we found that their top issues were the water, mold, pests, and the food. And yeah, it seems like people in New Jersey are potentially also experiencing those as some top issues and concerns for health. So I am not a water expert, but I am broadly someone who thinks about health and studies health a lot. So I'm so excited for this campaign and for the ways that it'll take hold. And yeah, just here to answer any questions that anyone has. Thank you.
Thank you so much, Dr. Yan. Like I said, we're going to open up the end for Q&A for our panel discussions, Dr. Yan, and then also X, who's going next. So I would like to introduce X Braithwaite, who is our environmental justice organizer on this initiative. She has literally been my right-hand man with everything, with getting the campaign out and the petition signatures and everything. So I'm going to let X introduce our Clean Water Initiative.
Yeah, thank you so much, Sydney. So, hi everyone, good evening. My name is X, like what was stated, and I'm the EJ or Environmental Justice Organizer for Clean Water Action. I'm very, very excited to be working with Sydney on this because, no surprise, environment is actually not my background. I am a community organizer and I've been organizing since I was about 14 with the Newark Students Union, originally from Newark. I actually live in the Ironbound section right now, so if you hear extremely loud planes or trucks, excuse that in the background. I feel like I hear one coming right now. But anywho, yeah, I'm really excited to be collaborating with Sydney because a huge part of my role is understanding like the I guess public health stressors in communities of color, and I'm going to talk a little bit deeper about that and the specific implications on New Jersey communities of color through, the research I've done over my year as an EJ organizer, but also through the research that Sydney's done on her own in her project. So very proud of that. And yeah, like I consider myself, a partner in this. I enjoy hearing people's stories and using that to fuel action, So I did community organizing like for deeply for the past probably 7 years. I graduated last year with a degree in community and justice studies and African American studies. So participating in, community actions is kind of where my base lies. And I'm hoping I get to know, you guys better and we can become advocates just addressing this problem because there's so many angles and tactics we can be doing, it's not just about the water, right? Like Dr. Yan said, it's about the carceral justice system in general and how it could be changed. So I'm going to talk a little bit about the campaign, a broader look at environmental justice and its implications. And yeah, any questions, feel free to put it in the chat or right after this, like Sydney said, we're having a Q&A. So can everybody see my screen?
Yes.
Awesome.
Yeah.
Okay. Okay, so our campaign is called Safe Water, Safe Lives, addressing the environmental hazards in incarceration facilities. So this is kind of an overview of Sydney's research. The problem is that a lot of people that are already in the carceral justice system or in incarceration facilities are already susceptible to health issues. About 60% of people in New Jersey incarceration facilities are African American and 14% are Hispanic. And in those communities, health problems like lead poisoning, respiratory issues, etc., are already exacerbated because of the communities they literally live in. So the problem more specifically that Sydney researched is that there are unsafe living conditions, obviously, in these facilities, heat risk, unsafe sanitation, flood risk, etc. And the problem is these are also facilities built on top of known contaminated sites or sites of, soil deed restriction, etc. So the land they literally are existing on is toxic while they're in the facility. So I just wanted to give an overview of what an overburden community is. I deal with that as a legal definition from the Department of Environmental Protection. So in New Jersey, an overburden community is any block group, which is kind of like the smallest census group they have. So you have a block group, you have a city, a county, etc. So that's the smallest geographic unit, and it has to be at least 35% low income, 40% identifying as a minority or member of a state recognized tribe, or 40% having limited English, right? And these definitions were basically drawn up by the Department of Environmental Protection because they saw the consistent patterns of people of color, dying prematurely or developing issues, public stresses or public health stresses that didn't exist in the first place for, their family, etc. And I'm also on the Environmental Justice Committee for the NAACP. I'm the vice chair. And environmental justice is an issue that has to do with civil rights and civil justice issues. This is a quote from the work plan, the 2024 NAACP work plan. It says environmental injustice, including the proliferation of climate change, systematically impacts communities of color and low-income communities in the US around the world. So Yeah, people talk about climate change, and it's easy to talk about it in broader terms, like, oh, the glaciers are melting, things are getting hotter, but we don't think about the immediate impacts on the people who don't have the infrastructure to deal with such sudden changes, So like I said, I live in the Iron Bound of Newark, which is one of the most highly polluted areas in Newark, right? It's called the Ironbound because it's mostly facilities and industry, and we're one of the, most vulnerable to flood risk. Like, sometimes things float around here if it rains too hard, right? And that's because we don't have access, we don't have as much surfaces that absorb water. They're called impervious surfaces, because we were built like a brick city. We were built from concrete, right? So we don't have that type of infrastructure that can handle natural disasters that come with the climate changing so rapidly. So these are a little bit of the statistics, and I love what Dr. Yan said, honestly, about how these truly aren't places for, people to be reforming themselves in the way that it's just formed in general. So we came up with this little saying: rehabilitation, not exacerbation. So like we said, incarcerated individuals already come from overburdened communities, and the DEP also has attached to overburdened communities certain stressors that they know for a fact these communities have. And if you look at this, right, so all the green areas are basically not affected by these public health stressors. And the dark blue areas are affected disproportionately than the light blue, but the light blue is kind of still affected. But the point is, they're in very concentrated zones. This is where industry is. This is where garbage and incinerators go to get trash from other municipalities. And this is where a lot of corporations conduct most of their businesses and have most of their industry. So that's a problem. And the statistics kind of show that, which is why we have laws in place now to protect communities from the type of facilities coming in. Before I started working on this project, I was deeply involved in the implementation of the environmental justice law, which is one of the, most progressive laws on environment in the country right now, because it basically says that the DEP has the power to reject any facility, any new facility that applies to be an overburdened community. So, say if Amazon wanted to build another warehouse, and it's like, oh, but we'll bring in, more truck traffic and more risk of cancer from the diesel trucks that are coming in. The DEP is going to be like, oh, well, that's an undue burden to this community. They can't do it, right? And that's not for no reason. They've collected this data over several years. Turns out, right, things like lead lead to health stressors in not only people in general, but specifically communities of color. So some of the statistics: nearly 300,000 children live in areas where lead levels exceed the federal regulations. And I only say this because lead is an indicator that the DEP uses on the overburden stressor summary. So when you look at this map, all the stressors, they have 26 stressors: cancer risks from diesel, exposure to contaminated sites, lack of recreational space, and potential lead exposure. I just decided to focus on lead because it's also a contaminant that's often found in our water, and most likely in water systems that haven't been serviced in a while, most likely incarceration facilities. So there are over 1,200 lead-related hospitalizations in the state, and communities of color are more than twice as likely to be affected by lead poisoning. And this matters a lot, right? Just this one contaminant alone can cause cognitive impairments, increased risk of behavioral issues and learning disabilities, problems with reproductive health, carrying some of those issues with the child, but also miscarrying and low birth weight. And one that I found like the most kind of egregious and eye-opening is high levels of lead relates to a higher likelihood of criminal behavior, and aggressive and impulsive behavior, because it affects kind of your brain chemistry, and there is no safe levels of lead in the body, right? Because it gets into your bloodstream, and it's extremely difficult to get your lead levels down once you have so much in you. So it creates a vicious cycle where environmental health risks may contribute to higher crime and perpetuate incarceration and poor health outcomes in communities of color. So with that being said, while facing these issues in their hometown most often, in some facilities, incarcerated individuals are only allowed 2 cases of water a month. So they already came with these issues, already struggling potentially in terms of health. And then they come here where those problems are exacerbated by the conditions that they have in the jail. So I just wanted to talk a little bit more about lead because side note, I made friends with the Department of Environmental Health, yeah, the DOH, and they gave me like a whole lecture, like a one-on-one lecture about lead and mercury. So I decided to include it, because yeah, it matters, not only inside facilities, but also how we treat each other or how we interact with our environment, when we're, I guess, back in our overburdened communities if we choose to go there. So neurological development, it decreases brain function, developmental, decreased kidney function, decreased muscle growth, etc. So lead is a huge problem when we find it in the pipes, or one of the stressors on the overburden summary is lead from old buildings. So when I heard somebody speaking about how a lot of these buildings were made with lead paint, that's definitely something that could be contributing to the health stressors in the facility. So, yeah, moms can transfer lead and mercury to babies. So that means, sometimes in the womb, people can be born with these issues that lead to even lower not only life outcomes, but also life circumstances in terms of health. So it's tied to heart, respiratory, and metabolic issues, as well as neurodevelopmental disorders at levels lower than the health limits that they have like legally now. So they honestly, the EPA and the DEP kind of tries to stretch the limits to allow facilities and, just honestly capitalistic moneymakers to put as much lead as possible without getting in trouble. So just because the health limit has, a state definition, it doesn't mean that that's the safe limit, just to let y'all know. So going back to why we are here, lead is one of the issues, but Sydney actually reached out to me in April about her research as a student at Keene. So she showed me a whole bunch of statistics, whole bunch of pictures. 13,000 inmates potentially suffer from health challenges due to restricted mobility and exposure to hazardous conditions. So these were actually some pictures shared by Sydney, right? These are the pipes, apparently they're supposed to be getting their water from, which are filled up, clogged up with trash, right? This is some water that came from the pipes, and this is mold issues, which probably are contributed by by the like the water in the facility. So a lot of these also come with reports. A lot of this information we got specifically through the Department of Environmental Protection's data miner. It's kind of like the step before Oprah. So if you can't find anything on the data miner on these facilities, you open an Oprah request. And a lot of the inspections, these facilities are consistently out of compliance. The DEP takes pictures like this, they find them, but they never do anything about it. So they're aware of the conditions. It's just we need some type of, it seems like they need some type of outside motivation, people like us who want to disrupt systems of oppression, right? I would hope to motivate them. And I want to talk about that a little bit on the last slide, but like Sydney mentioned before, half of New Jersey prisons are facilities that are known contaminated sites or located within a mile of them, which exposes just by the area inmates to lead, arsenic, and other substances. And also climate vulnerability, right? A lot of the prisons in New Jersey reach temperatures over or up to 94 degrees Fahrenheit. And in her research, some incarcerated people describe the conditions as like hell. So another thing is when we mention climate vulnerability, Superstorm Sandy already contributed to damages to the infrastructure of certain incarcerated facilities. So their infrastructure is already weakening, and the climate change is only getting more and more close to home. The sewage overflows, etc., the floods that contribute to that. So their weakening infrastructure is not good compared to the things that they're still not keeping up with, like the water and the maintenance, etc. So places like Mid-State, East Jersey State Prison, etc., they have a lot of serious issues when it comes to water quality, like consistent violations going back to, sometimes even the start of, honestly, when the data miner was formed. Like, you can kind of put the I guess the date ranges from, like, the 90s to like 2024, something like that. So a lot of these facilities have had consistent violations, and like Sydney mentioned earlier, some of them are under community water systems, which means more access to information, which is good, yay, but have still been inconsistent violations. So without, and another thing is they get a lot of violations for not reporting. So we don't necessarily know, all the contaminants that can be in the facility if, a lot of their violations is just, oh, you never submitted your report for this, there's no way of telling if they were complying or not. So yeah, contaminants like volatile organic compounds can be found in the water. And honestly, I read some of Sydney's reports. They have been found, and things that just don't make sense, like egregious things, like E. coli, finding E. coli in the water. From what I understand, that can only happen through sewage mixture, right? There somehow people's drinking water is being mixed with sewage in some cases, and that just isn't fathomable to me, So what can we do? First off, we have a petition for folks to sign, and I can put the link in the chat after I stop sharing. We are partnering Women Who Never Give Up and Clean Water Action to basically call on the DEP and the Department of Corrections and any local regulators, mayors, council people, etc., to address these issues and take them seriously. And we have a couple demands, and they're outlined a lot more in the petition website. But what we're asking for is, one, immediate, safe, clean drinking water, right, at reasonable rates, not 2 cases a month per person, for people who are incarcerated right now. So making sure that they immediately have changes in their conditions, evaluations of the water systems, and then improved management and oversight. So a lot of these facilities don't even have budgets for water maintenance right now. And that becomes a problem. So here's where we are. I actually typed this up really quickly because I know towards the beginning of the session, somebody asked, like, what's the next steps? What happens after this? And me and Sydney have been doing a lot of work behind the scenes, making a lot of stuff happen. And I just really appreciate, like, all the support. It's crazy that there's like 35 people on this call, because it's just me and her thugging it out with a Google Doc. So this is where we're at so far, and hopefully I'm hoping to get more suggestions from folks, especially folks with experiences in the carceral system, on what we can be doing to support people not only in the system but also when they get out. So we're trying to get a lot of community partners on this. The ACLU is aware. I think we have a couple folks from there on the call. Lead Free New Jersey is also partnering with us. Cassie Bollinger, I think she's the director. Correct me if I'm wrong, Cassie, from Life Free New Jersey. She's also on this call, and the Newark Water Coalition is also a big supporter of this. And we're trying to look for more community partners. We launched the petition about 3 weeks ago, and we already have 120 signatures. I'm very happy about that. And then it comes down to, what can we do to change this on a systematic level? So we're looking into building a draft of local ordinances to present to council people about just putting a budget in place to whatever facility is within their jurisdiction. And then also even branching out, on a larger scale to state policies. So Sydney actually made me aware, I think yesterday, that there is this act called the Environmental Health in Prisons Act, which basically kind of asks for all that we're asking for in our petition. And I think advocating in that is being endorsed by the prison something initiative. Hold on, this is the last slide. Can y'all see my screen? You can see the website. Okay, yep. The Prison Policy Initiative. So they have endorsed this act from Senator Ed Markey, which basically recognizes, you know, the right for everybody to live in a healthy environment and tries to put protections in place about, you know, the hazards that people are experiencing and nobody is reporting. So I just wanted to show you guys this because I think this is kind of a really good model for what we should be expecting. You know, the DP to hold the Department of Corrections to. So, you know, stricter monitoring on environmental hazards like air pollution, water quality, temperature, mold, etc. Requires, you know, the people in the facilities to actually be informed of potential health hazards. So all those good things, you know, we want to make possible. And it's through engagement sessions like this. So we hope to have more engagement sessions, you know, definitely with people who have had experiences in the system, but also those as advocates, potentially turning this into like a participatory action research project to gain, I guess, more community voice on the issue in the academic world, because people haven't really written about this before, you know, and specifically in the New Jersey prison system with the EJ law in mind, we should be actively protecting, you know, people incarcerated in facilities of incarceration. And the last thing is we hope to have community initiatives. Maybe Sydney can talk a little bit more about this, but I know we were in the last week, we went to the Returning Citizens group in Newark, and we talked a little bit, you know, about how our project is going, and we hope to be out in the community more, you know, doing our own events, but also just supporting partners as well. And that's all I have for folks. Yep. And I just want to thank you guys again. Thank you, Sydney, for, you know, partnering with me on this. And I hope this is a very, very fruitful, you know, campaign. So
Thank you so much. And like X said, she kind of basically talked about everything, like the goals that we have. I know Ronald had a question about what's next. So next is really having those stern conversations with the NJDEP and with the NJDOC about the violations, because it hasn't been a one or two thing. It's been going on for years, and it needs to be held. They need to be held accountable. So Ronald did also bring up OPRAs. We have actually drafted up OPRAs. We're getting ready to kind of like submit them to get more information on those facilities that are not public community water systems. The ACLU has been tremendous in helping us draft up the OPRAs and kind of like the process with OPRAs. And then from that, we really hope to pass local ordinances and laws, because yes, there is a federal law coming in place, but we also need your community, like everybody in the community, to help provide oversight. Each state, each prison has its own specific needs, its own problems. And so there are certain things that needs to be said about certain facilities. And we need your help with that signing petition. And I'm really excited that we have over 120 petition signatures. So that's really great. I know it is 7:30. So like I said, I do want to be very mindful of everyone's time. If you do have questions, please feel free to reach out to me. I will send a follow-up email about the webinar resources, other infographics. A lot of the pictures that X and I showed today literally came from the NJDOC's Ombudsman's website. So public records, public inspections. So please feel free to go on the website, look that up. And we will also be sharing that. But I do want to thank everyone again for joining the session tonight. Thank you to our amazing panelists, our moderators, and our speakers. This started as literally a pipe dream, I want to say, a year ago, and to see it come to fruition and have you guys all sharing your experience and all learning about such a huge issue is amazing. I really do appreciate everyone's support. Like I said, also, please make sure you sign the petition, fill out the petition, and we will stay connected about upcoming events, sessions, local ordinances that we're trying to get passed, public hearings, and all of that. So thank you all so much for coming out tonight.
thank you so much. That was great, Sydney.
And the link for the petition is also in the chat if you guys need as well.
Thank you all. This was really, really good. This has been a 25-year-old dream for me come true. So I'm glad that so you only had to wait 1 year. So this is good, guys. Thank you all for showing up. Good to see everybody's face. We have work to do. We have people's lives to save. Let's get it. Let's get it. Thank you all so much and good night.
And Gail, you know you can count on the office to be
I
where
know. That's our ombudsman there representing the state of New Jersey. Just make me so proud. I don't even want to start that, but I love you all. Thank you all so much for joining us. And we got work to do. Let's get clean water. It's not a privilege, it's a right.
And thank you, Sister Gail, for showing up again. It's been, like I said, it's been a while since you were up in Trenton when I was there. And, you know, right after the gun was found. And so I hadn't seen you in a while.
They kicked me out, bro. They won't let me in no more.
Hey, it had, well, they done kicked me out. So believe me, I ain't
We'll
going
fight
back.
from outside. That's all. That's all. This different. We fight from outside, inside. That's all.
Hey, look, it's gonna be a harder fight now.
Yes, sir. Yes, sir. All right. Good evening, everyone. So good to see your faces. We got work to do, and I'm ready.
Hey, speaking of which, anybody who's got an actual place like I could start as an individual, please send me something. Right. I'll just put my email in the chat and just, I don't know, anywhere that if you guys, anybody has an idea of what I can do, like actually do to contribute, I'm in. Please.
Yes, definitely. We're going to send a follow-up email about the webinar. You're going to get the recording of the webinar and also some infographics and some other additional resources. So everyone will definitely be in the loop because we can't do it alone. We need everyone's support and everyone's help.
And I just got to figure out how to do it. That's all.
We got you, Phil.
Hey, what does this thing mean that you have 25 messages? What does that mean?
It's just from the chat. People have been saying things in the chat. Yeah. But thank you all for coming. And we'll definitely be in touch soon.
All right. You have a good evening.
Have a good night.
All right. Thank you, everyone. Good night. Thank you.
Night.
All right, Hot.